Danielle. I'm going to be your nurse today.
Hello.
My patient is Zach. He's a 28-year-old male. He is, on my general survey, awake, alert, oriented. He's well-groomed, has good posture, and appears healthy. My environment is well-lit, warm, and quiet. I am first going to demonstrate the 4 assessment techniques. I'm going to begin always first with inspection, looking at the skin, the hair, the nails, looking for any signs of injury or trauma. My patient's skin is clean, dry, and intact. No signs of obvious injury or trauma. I am next going to auscultate. I am going to use the diaphragm on my stethoscope to listen to normal heart, lung, and bowel sounds. I can also use the bell of my stethoscope to listen to any abnormal sounds such as heart murmurs. I have you lean forward. Couple of deep breaths. Good. You can breathe normal. My patient's lungs are clear, his heart rate and rhythm are regular, and bowel sounds are present in all 4 quadrants. You want to make sure you auscultate before you palpate or percuss because you don't want to create any extra sounds. I'm going to have you lean back just a little bit. I am next going to palpate. You can palpate the skin for texture, temperature, any changes. You can also assess for any tenderness or rigidity, any abnormal lumps or any swelling. I'm just going to palpate the abdomen. Any areas of tenderness? Okay. And last, you can percuss. You're going to be checking for amplitude, pitch, quality, and duration. Organs like the lungs that are more air-filled are going to have louder, longer sounds, whereas dense organs like the liver are going to be more softer and shorter. Next, I'm going to check my patient's vital signs. Okay, under your tongue. Okay, his temperature is 96.9, which is just normal. While I was checking his temperature, I was also counting respirations. They were 16, even and regular. You want to make sure you don't draw any attention to the fact that you are counting them, though, because the patient can alter their breathing when they're actually thinking about it. I also counted his pulse and checked his blood pressure. His pulse rate was 73, which is perfect within the limits of 60 to 100, or 50 to 90. And his blood pressure was 117 over 59, which is perfect within the limits of less than 120 over 80. And oxygen saturation was 99%, which is perfect. It should be 90 to 100. My patient is 6'2". He's 202 pounds. That calculates to a BMI of 25.9, which is just slightly overweight. All right, and next I'm going to assess his pain. Are you having any pain right now?
No.
No, no pain anywhere. Okay. Should my patient say they have pain, I would assess for any patient's behaviors associated with it, any grimacing, moaning, crying, or guarding. For patients of this age, would use the number scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable. I would also then ask the patient to describe any precipitating or alleviating factors or how it has changed their daily activities in any way. I would also ask the patient any typical pharmacological or non-pharmacological methods they use to relieve their pain. Last, we'll do the nutrition assessment. How many meals do you typically eat or snacks per day?
Roughly 4 to 5, well, three meals, 2 snacks a day.
Okay, and what typically are you eating?
It varies from proteins, typical everyday food. I mean, fast food as well.
Okay. Any religious or cultural restrictions?
No.
Okay. And your weight, what is your usual weight?
Fluctuate anywhere from 201 to 207.
Okay, have you experienced any recent weight loss or gain?
I recently lost around 12 to 15 pounds over the past 4 months.
Were you trying to lose weight? Was this unexpected?
Yes, I was trying to
Okay.
lose a little weight.
All right. Have you experienced any changes in taste, smell?
No.
Okay, and any difficulties chewing or swallowing?
No.
All right. And any recent trauma, any injuries or burns?
No.
No. Okay. Should my patients have any injuries or traumas, a lot of weeping or weeping wounds, effusions, blood loss, they can all increase nutrient loss, and increased nutrition also helps healing. Have you experienced any nausea, vomiting, diarrhea, or constipation?
No.
Okay. Should they have said yes, I would have inspected a little further and asked how long. And any food allergies?
Yes, I am allergic to shellfish seafood.
Okay, and what's your typical reaction should you become exposed?
Extremely nauseous.
Okay. All right. And are you on any medications or supplements?
I take a daily men's vitamin, that's it.
Okay. Good. And what is your ability or access to cooking, ability for transportation to go get food, income for food? How is that? Are you able to do all of the above?
All of the above, I do. Yes, all of the above.
Okay. And what importance do you place on your meals?
I like to eat. I would say it's just as important as most people would consider an average meal consumption per day.
Okay. And at 28 years old, my patient is able to feed himself. Any alcohol or drug use?
Yes, alcohol.
Okay. How much per day, per week?
5 to 8 drinks per week.
Okay. And when was your last drink?
This past Sunday.
Okay. And what's your typical exercise routine like?
I'm lacking in my exercise. I don't really have an exercise routine.
Okay. Someone your age, you're fairly young, it'd be probably good to increase your exercise at least 30 times per week of moderate exercise. 3 times per week for 30 minutes. Sorry. And family history. Do you have any family history of coronary artery disease, diabetes, osteoporosis?
No.
Okay. And what importance did your family ever place on meals?
Usually it was convenience. I never was extremely extravagant or anything, but more fast, easy, convenient meals.
Okay. And thank you very much, Zach. It was nice meeting you.
Thank you.